Hello everyone and welcome to our webinar entitled Healing Arthritis, Taming the Flame by Treating Oxidative Stress. Our guest speaker today is Dr. Susan Blum. My name is Michael Chapman and I'm a medical education specialist at Genova's Asheville branch. I'm going to serve as the moderator for today's webinar. We would like to welcome Dr. Susan Blum. A true pioneer in functional medicine, Dr. Susan Blum is a nationally recognized clinician, speaker, author, and teacher. As the founder and director of Blum Center for Health, and through her education, writing, research, and medical mentorship programs, she is revolutionizing the healthcare industry and the lives of those with chronic illness. A member of the Medical Advisory Board for the Dr. Oz Show and the Institute for Integrative Nutrition, she is on the board of directors for the True Health Initiative in the College of Lifestyle Medicine. Dr. Blum also completed her internal medicine training at St. Luke's Roosevelt Hospital and is a board certified in preventative medicine. Certified in functional medicine, is senior faculty with the Center for Mind-Body Medicine, and the author of the Immune System Recovery Program. Before we begin, I'd like to encourage all of our participants to let us know of any technical issue you're experiencing so that we can try to assist you, as well as any clinical questions you have throughout the webinar. Please type these issues or questions into either the chat or questions boxes, making sure to send them to the organizer at any time during the webinar. We will begin compiling your clinical questions and answering as many as we can in the final 15 minutes. One of the most common questions we get asked during the webinars is about the availability of this presentation and the slide deck. These materials will be available on our website within a week of the webinar. If you're interested in having these resources, please click the Clinicians tab on the homepage where you will find access to our webinars under Medical Education. Or you can also log into your MyGDX account to find these webinars. If you do not have a MyGDX account, please click on the Getting Started link on our homepage. And without further ado, I'm going to turn over the controls to you, Dr. Blum.
Okay. Great. Thank you. Show my screen. I think we're good. All right. So can you see my screen?
Yeah, looks great.
Okay, perfect. All right. Well, hi, everybody. Welcome. I'm very excited to be here to talk about arthritis. I think arthritis has become a big passion project for me in the past couple of years. As many of you know, I have a book that came out, my second book. The first one was on autoimmune disease, and I spent a lot of time, in 2 decades of practicing functional medicine. Those of you out there working with complex chronic illness, you probably already know that we see tons of autoimmunity, and a lot of those people have arthritis, and we also see tons of arthritis that's not necessarily autoimmune as well. So arthritis is a really important inflammatory complex chronic illness that affects about 30% of people. And so it's a really big issue. And of course that prevalence goes up as people get older as well. So and writing the book and doing the research for the book, Mike and I were sort of joking about the, what happens when you write a book, for any of you who've ever had that opportunity, is you do a lot of research, or if you give a talk or any kind of presentation, you really dig into the research. And I really, so I've become now, I really do feel like I'm an arthritis expert because I've read so many studies. And one of the really cool things that I learned as I was digging through the research, and I have this, this is sort of included in the book as well as what I want to talk to you about here, is this idea that, this concept of oxidative stress. And I know that in the early years of going through my functional medicine training, I really didn't understand quite what that is, what it refers to, how it's relative, how to measure it, and all of that. And so I've really come to understand that, oxidative stress, which we're going to talk about exactly what that is, but in the literature, there's really a huge sort of association, or a lot of work being done looking at the underlying mechanisms of damage in the joint capsule, and oxidative stress is one of the major culprits. And so it's a really important thing for us to understand how to measure it. And what I want to show you today is that we can, is that measuring, and actually maybe I even have that in my next slide. Let me see. Yeah, the objectives is that I want you to learn about the role of oxidative stress in triggering inflammatory arthritis. Like, how is this part of the causality, of what's going on, understand how to test for it. And of course, that's why I'm doing this webinar with Genova, right? Because Genova offers a lot of opportunities for you to follow, to assess the levels of somebody that's in front of you and their levels of oxidative stress, and that actually doing this is an important sort of data to help you guide your treatment, and that it really reflects what's going on with the person, and which is very, very helpful, I have found in my practice, and I want to share that with you. And then how to find and treat the root causes of oxidative stress. And we'll talk about what those are as well. And, you know, what I really come to appreciate is we talk about inflammation, inflammation, inflammation. And in my first book, The Immune System Recovery Plan, it's a 4-step program for basically finding and treating the root causes of inflammation. Well, I didn't really talk that much about oxidative stress. And in the Healing Arthritis book, I talk about it a lot more, because I've come to appreciate that one side of the coin is inflammation, but oxidative stress is part of the fuel that fuels inflammation. And that where there's inflammation, there's oxidative stress, and where there's oxidative stress, there's inflammation. And so rather than just measuring anti-inflammatory markers and or inflammation markers, sorry, and doing, giving people anti-inflammatory supplements like turmeric and stuff, you know, and other anti-inflammatory sort of approaches, which I do here and I'm going to show you, there's a need to treat the oxidative stress as well. And so I'm very excited to share this information, because for me, this is new. This is newish in terms of how it's come to sort of the forefront of my thinking, as opposed to being more towards the back end of my thinking. Okay, so so let's just start out by defining the problem, or defining the scope of what are we talking about here. There are many different types of arthritis, and I think especially like in the book, I make a really good, the whole first section is what kind of arthritis do you have? And the reason why that's important is because, for a couple of reasons. I think it's important that we rule out, that you help people rule out acute forms of arthritis, and more of acute things like infectious arthritis from a virus like parvovirus. That's usually self-limiting, 6 weeks or so, and it should pass. If it's a reactive arthritis from an ongoing other infection in the body, that'll clear when that infection goes away. And then it's also important to diagnose things like Lyme disease. Mycoplasma is another trigger for arthritis that you want to test for and check. But then at the end of the day, when you've ruled out the acute forms of arthritis, you want to be able to, you want to know what kind of arthritis you have from this list of sort of your chronic inflammatory arthritis conditions. And these are the main categories. I would say the two main categories are the autoimmune and the osteoarthritis, but gout is very prevalent as well. But gout is very prevalent as well. I'm going to focus more on autoimmune and osteoarthritis as well today, and the research on that. In terms of gout, though, you know, look, uric acid crystals that's deposited in the joints, which are driven from a systemic illness, right, a metabolic syndrome or insulin resistance driven in diet, creates oxidative stress in the joint. But we're going to focus mostly today on autoimmune and osteoarthritis. And so the autoimmune category includes the classic autoimmune arthritises like rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. Psoriatic arthritis and ankylosing spondylitis together are called the spondyloarthritises. They're sort of grouped together because they have overlapping patterns of the joint involvement. And rheumatoid arthritis is definitely its own whole category. But you can also have arthritis, inflammatory arthritis from a rheumatic disease. And so you might have somebody with lupus, or you might have Sjogren's, or even scleroderma, or even things like fibromyalgia are not so common. Usually that's more of a muscle-related, not so much an arthritis condition. But systemic autoimmune diseases, the ANA positive groupings, which I didn't mean to insinuate fibromyalgia is in that because it's not ANA positive, but I was just saying there are other conditions that can trigger, inflammatory conditions that can trigger inflammation in the joints and arthritis. So that's that first whole category. And then there's osteoarthritis. And I'm here to tell you, and I've come to appreciate so much, that osteoarthritis is really not inevitable as you age, even though everybody thinks it is. Osteoarthritis is often dismissed as inevitable wear and tear and aging, but osteoarthritis is actually a lot more. And, you know, there's true damage to the joint, which is not related to just wear and tear. And when it comes to both autoimmune, to all these chronic inflammatory conditions, what we know, and this is true for osteoarthritis as well, it's so easy to just dismiss someone with osteoarthritis and say, oh, well, okay, you have that here, take some anti-inflammatories. It turns out that no matter what kind of chronic inflammatory arthritis you have, any of these on this slide, inflammation that begins elsewhere in the body is triggering a lot of the inflammation, oxidative stress, and pain in the joints. These are systemic diseases, systemic conditions. The joints, you know, this is our classic functional medicine mantra, right? Or integrative medicine. Whoever's listening, we don't always have to just call it functional medicine. But our mantra for people practicing whole body medicine or systems biology medicine, it's really about understanding that that's all connected. And the inflammation ends up in the joints, but that's not where it begins. And so we have to look at all these as systemic issues. And that's what we're going to dig into today about, you know, why, where the inflammation is coming from and what we know in the research that supports that. All right, so basic science. And, you know, I found this so helpful when I'm not an orthopedist, right? So it was really helpful for me to look at actual pictures and try to understand what's happening. And so what I want you to see here, and let's see, I'm screen sharing so you can see my mouse. On the left side is a healthy joint. And you can see the different parts of the joint. And this is sort of the knee. This is sort of the classic sort of knee joint. I think this picture is the knee. And the things I want you to notice are so there's something called a synovial membrane, right? And it's on the outer surface, but the synovial membrane makes synovial fluid. And synovial fluid is really, really important for buffering, for sort of being the word buffer, but more of a physical buffer, right? To keeping the bones from either side of the space from abutting each other, right? So you need space between the two bones, and so that the joint doesn't, so that you don't get wear and tear in here. And so the synovial membrane makes synovial fluid. And then you have what's called the articular cartilage. And this is just, it's just cartilage. It's called articular cartilage just because it's in the articular space. But it's just a layer of cartilage. And what the layer of cartilage does is it protects the ends of this is your bones. And the cartilage is protecting the bone from you ending up bone on bone, which will damage the bones themselves. And then you're really in trouble. And so when you come over here, so this is a normal joint. When you come over here, you can really see, and actually maybe I should move my control panel so you guys you don't need to see that. So you can see over here that there is what's going on. And so what happens is a lot of the studies looking at oxidative stress shows that these free radicals, which we'll talk more about, and these, you know, reactive oxygen species, free radicals, they start damaging the synovial membrane, and you start getting synovial hyperplasia, right? So overgrowth of the synovial membrane here. And then that leads to poor synovial fluid. The fluid becomes thicker, not as buoyant, not as lubricating. And you start getting then the cartilage starts thinning because the cartilage actually has its own damage from the oxidative stress. And actually the chondrocytes that make the cartilage are affected by the oxidative stress, and the chondrocytes start sort of not being able to make and repair the cartilage anymore. And you get damage to the cartilage, and you can see how sort of irregular and damaged this whole surface becomes, and then you end up with damage to the opposing bone. And that's how you end up with arthritis. Now, so a little summary for you again. What I just said is that in a healthy joint, the synovial membrane is this sort of soft tissue between the joint capsule. It secretes synovial fluid that lubricates the joint, and it really protects the lubrication, and the fluid protects the joint from the damage. And the cartilage lines the surface to protect also from damage. So in a healthy joint, you really have this great, like, healthy synovial membrane. It's making good amounts of fluid, and the cartilage is healthy and protected. But under certain conditions, you can end up with a problem in damage to these tissues. Now, the origin of the damage is different when you look at autoimmune versus osteoarthritis. And so here's where it sort of gets interesting. There's definitely known, so both autoimmune and osteoarthritis have oxidative stress, right? The last sentence here, damage is caused by increased oxidative stress. But each one has a different flavor about sort of the origins of the oxidative stress and where it's coming from. And so when it comes to autoimmunity, you have really good research, which I'm not going to dig into that today, but I have all sorts of other places that I talk about that, whether it's in my sort of YouTubes or my, I have all sorts of videos that I have, and, and my books and everything. Like, I talk about this on and on and on about, and we're going to do a little bit of, I am going to do a few slides on the gut today, but there's a lot more out there that you can certainly read about. But the gut, gut dysbiosis, leaky gut, bacterial cellular proteins, we'll talk about that, oral microbiome and rheumatoid arthritis, really, really good research looking at that. I'll tell you more about that in a sec. Other infections and toxins, but triggers for autoimmunity. And eventually ends up as oxidative stress in the joints. When it comes to osteoarthritis, there's definitely aging or injury. As you get older, there is wear and tear, and injury puts you at an increased risk 100%, and probably a lot of you out there know that for yourselves. You might have had an injury, a skiing accident or another kind of accident or something where you broke a bone, and you've had arthritis in that joint ever since. However, I'm here to tell you that it's not only that that's going to cause the arthritis, it's that plus the systemic inflammation. And the literature is now really filled with a lot of great information and studies that are looking at osteoarthritis as a metabolic disease. And that there's this huge connection between visceral adipose tissue, metabolic syndrome, insulin resistance. There's definitely some research looking at the gut microbiome as well. But this connection between sort of leptin and the adipokines, sorry, that word just always sticks in my mouth, but the cytokines that come from the fat. They found high levels of that in the joint space of people with osteoarthritis. And so there's a lot of research looking at that and looking at the fact that, we all know, and a lot of people, there's a lot of studies that show people lose weight, the arthritis gets better. But now we're understanding it's not just about the mechanics of taking the weight off the knee, for example. It's about the reduced body fat, the reduced visceral adipose tissue, the lower levels of leptin that actually are responsible for the improvement of the pain and the improvement in the arthritis. So it's not just about losing weight, it's about losing body fat, that we're now digging into the real understanding, the nuances of those studies. And so there's this huge connection. And so I want to leave you with this. Both, no matter where the inflammation, first of all, there's an overlap, right? So inflammation coming from the gut or the oral microbiome is still going to increase inflammation in your joints if you have osteoarthritis. It might not be the primary mechanism, but it will definitely affect your joints. And so you must also make sure the microbiome is in good shape in people with osteoarthritis as well as autoimmune. Just like in autoimmune, where your primary sort of attack of the whole, using attack tongue-in-cheek, but your primary first steps might be all about healing the gut, which for me it is. Most is in arthritis, it 100% is, not separate from just all autoimmunity, but for arthritis, I always, the research supports this, and I've had that experience. We're starting with gut repair is usually where the money is. You also need to look at the body, the visceral adipose tissue, as a component of triggers for oxidative stress and inflammation. So both categories need to, you need to address this. You need to address everything with everyone, right? The only other thing I'll say, though, about needing to know which one you have, in terms of coming back to how important it is to make a diagnosis, of all these chronic inflammatory arthritis conditions, well, you want to know if it's gout, certainly, because that's going to have a different treatment approach, perhaps, because there are things you can do to reduce uric acid. But when it comes to just in general, rheumatoid arthritis elicits a lot of fear in everyone. I'm not going to get into that too much, but this seems to be this really important need to know. And I sort of agree with this in some ways. If somebody comes to you and they're in a huge flare with rheumatoid arthritis, and there's a big concern that the joint damage is going to happen really quickly, and they're going to rapidly deteriorate to irreversible joint damage, sometimes, I think it's really important to know if somebody has rheumatoid arthritis, because you need to know if you're in this sort of race for time before, if they're in the throes of potentially ending up with irreversible joint damage. When we're in that moment, I often do work with rheumatologists, and sometimes they do need medication while we're also doing this work. Okay, so I just want you to throw that out. Okay, so now let's talk about oxidative stress, what it is, sort of what it is and how it's involved. So the first thing to keep in mind, and wait, I'm just taking a sip of water. I do talk very fast. I hope everybody's okay with how fast I'm talking. Okay, there's a lot of information. I just want to make sure to get through to you guys. So oxidative stress is a normal process, okay? It's not bad. Every day, your biochemistry makes free radicals. Your mitochondria are fired up with tons of, it's a natural process in the mitochondria to make a lot of free radicals because it's like a combustion engine. You're generating free electrons in the electron transport chain and all of that. So every day, you're making free radicals. And every day, you're supposed to eat antioxidants to quench the free radicals and to sort of put out the little embers, I like to say. I mean, you're all health professionals, so I don't need to use my lay language, but when I talk to, the lay way of thinking of it is just a lot of little embers brewing in your body as an end result of all your biochemistry, and you always need to put out those fires. So antioxidants are always the way we do that. Now, it's possible, though, so what happens? How do you end up with this thing called oxidative stress? So the term oxidative stress refers to sort of a stress in the system because the free radicals are winning, right? And so there should be, it's this idea of this net. It's really your levels of oxidation, in the body is a net between how much free radical activity there is and how well you're doing to keep up with it. Now you can see that you can get out of balance if you have a lot of extra sources of free radicals beyond your everyday biochemistry. So things like dysbiosis in the gut, things like toxin exposure, things like, toxins right in the food. And I think about food, I think of what's coming in that could be bad with it, as well as on the other side of the equation, not having enough antioxidant activity, whether it's vitamins, whether it's usually just nutrients, right? You're either not getting it in the diet in a intense enough way, like you're not getting enough abundance of antioxidants in your diet, or the gut is in such bad shape that you're not digesting and absorbing and getting into your diet and assimilating into your body, what you're eating in your diet. So either way, high levels of oxidative stress, so this is what we can measure, is a net. It's an imbalance between too much free radical activity happening from just your inherent biochemistry or additional sources, which is really what we're going to focus on, and not enough antioxidants to keep up. And so what ends up happening then is these free radicals that you have this net oxidative stress ends up damaging your tissue. And in the joint capsule, you end up with this hyperplasia of the synovial membrane. I said this before, right? Thinner fluid, less lubricating. Eventually, you have cartilage and then bone damage. And in the literature, there's really great sort of pathophysiology studies looking at this. And so one example of a study that, and you'll have these slides started here, the references over there at the bottom, but really good studies. I have two studies I put up for you on rheumatoid arthritis, where they really looked at levels of glutathione, vitamin C, A, E, and beta-carotene. And what I love, what's so fascinating, and it's not just about pathophysiology. They actually looked at this in people with RA, and they found that, and actually they looked at lipid peroxides, they looked at oxidized LDL, and they looked at 8-OHDG, right, which is DNA damage. Lipid peroxides is cell membrane damage, and then protein oxidation is the oxidized LDL. And they looked at, and actually that's also lipid peroxidation is LDL, but they looked at these levels, and they found that in addition to the levels of the vitamins, that these oxidative stress markers followed how much pain someone had and how much disability. So the more pain and more disability, the lower the levels of antioxidants and the higher the oxidative stress markers. And so I find that so fascinating. And actually, so the people with and actually there are other studies, I don't know if I have them up here, but as people improved and got treated, the oxidative stress markers went down, and they correlated with the improvement in clinical and how they felt. So we know oxidative stress is really important. And so in osteoarthritis, this is what I found also is interesting, is that chondrocytes themselves, when they're triggered and with other free radicals, like the leptin that comes in, and ongoing inflammation, they themselves, it's like a feed-forward cycle. They produce more reactive oxygen species. And this really affects the cartilage. And so there was one study that I found that looked at in 2016 in a rheumatology journal that actually looked at vitamin C. And when treated with vitamin, they had low levels of vitamin C, and they gave more vitamin C to these people with NeoA, and they found that their pain stabilized and they didn't get worse over time. So looking at these antioxidants. So how are we going to treat oxidative stress? So the first thing that we want to know is, where is it coming from? Of course, we want to increase the amount of antioxidants, and I absolutely do that. I'm going to show you. We're going to jump into a case study very soon. Let me just check my time. We're going to move into the case study in a slide or two. And so the treating oxidative stress is, in addition to helping sort of increase the intake of antioxidants, you want to reduce the amount of where you want to find the root causes of oxidative stress, and they're very similar to the root causes of inflammation. And so you all have been doing that for a really long time, and I want to encourage you to think about oxidative stress as you're doing your evaluation and root cause treatment for inflammation. And so the gut health is the same. It's just like inflammation, right? Oxidative stress, these free radicals and reactive oxygen species are part of, and they're upregulated by all the inflammatory cytokines. They work together. Diet, stress and trauma, environmental exposures, infections, and this is, like I said in my, my autoimmune book, I focus a lot on the first four: food stress, gut, and detox, and infections, those five. And then this time around, what's evolved for me is this really understanding about bringing in the obesity discussion, but also the oxidative stress coming from there. And so you have to look at all these root causes and treat them. And so, okay, and so a few slides about gut arthritis, because when you look at your root causes, first thing for arthritis is really, really important to understand that you have to really, especially in the autoimmune arthritis people, you have to understand there's tons of research looking at damaged tight junctions, zonulin, leaky gut, and this whole idea, and I love this is on the next slide. So I don't know about all of you, but I've been doing stool testing for almost 20 years, I think. It's a long time, maybe 18 years, I don't know. I started in 2001. And I've been doing stool tests for a long, long time. And I've always noticed that these bacteria, Enterobacter, Klebsiella, Citrobacter, proteus, and I don't know if all of you have seen, especially these, and Pseudomonas, are all these gram-negative rods. These Enterobacter, this is the category of Enterobacteria. It's a whole grouping. And these bacteria have very immunologically stimulating components in their cell wall that trigger our immune system like crazy. And these are the autoimmune triggering bacteria that are in the gut. And they have this thing called bacterial cell wall components that studies have found inside the joints in rheumatoid arthritis people. So studies have found that rheumatoid arthritis patients have a strong immune response to these bacterial cell wall proteins, and that these proteins have been found in the joints. Okay, it turns out you can actually measure LPS, and this is sort of on the front edge of studying in autoimmunity and leaky gut, measuring the degree of a leaky gut. Because what happens is, if you have these bacteria in your gut, in your microbiome population and overgrowth, and you have a leaky gut, these bacteria slip through the lining and end up traveling around the blood circulation and trigger an immune response. And so we have to get rid of these bacteria from the gut, and we have to heal the gut. Now, I think it's really, really, really important for us to think about the gut as an ecosystem. The gut is not a quick fix, and this is sort of my whole pitch to all of you, to realize that two things. First, for yourself, as you're treating people in terms of the gut repair, the 5R gut repair system, or however you think about your gut repair process that you take your patients through. There's always this quick start, like the first few months, it's a honeymoon, right? Everybody's feeling so good. Oh my God, you put them on an elimination diet, you take you do the food part, right? You get them off of the processed diet. Okay, there's our mark at 30 minutes. You fix the food, and you get them on an anti-inflammatory diet. You help them some sleep and stress, really important. And they're starting to feel real, and you work on gut, right? You sort of do gut. I use herbs to sort of kill off the bad microbes, and I'll show you that in my case study, how I do the gut process. But right away, people feel well. But at the end of the day, the gut is an ecosystem, and you need a long-term plan, and you have to understand that you might end up, especially in your sickest rheumatoid arthritis or inflammatory arthritis people, 4 to 6 months later, you're doing another round of gut cleanse. I call it like gut cleanse herbs, or however you want to think, berberine, black walnut, uva ursi, artemisia, blends of herbs, and you're doing another round of gut repair. But even if, as you're doing your supplements will never fully do the job over the long run unless you really help people do all this other stuff. Can't do anything about childhood, but you must work on lifestyle. You must work on food. Food and stress are the numbers 1 and 2 things that influence the gut in the biggest way. Okay, so you will never repair the gut microbiome if somebody still has a terrible lifestyle and is eating, gut damaging food. And you need to clean up their world from toxins, because toxins like glyphosate damage the gut, medications, alcohol, all of that. Okay, so it's my little pitch to you. That's why my 3-step arthritis protocol is, first, it's a leaky gut diet for arthritis, so the food comes first. Step 2 is healing the gut, and step 3 is finish what you started, right? It's a 6-month plan to repair the gut, balance the gut ecosystem, because we all get caught up in quick fixes, 30-day this, 21-day this. It's just the beginning. And that you must shift your thinking in the gut into a gut ecosystem. Okay, that's just, I needed to tell you that, because that's another one of my pearls that I've learned after doing this many years. Okay, let's come back now. It's time to talk about testing. High levels of oxidative stress. So summary, we need high levels of oxidative stress, all types of arthritis. Interestingly, oxidative stress markers predict relapse. People apparently in remission. Okay, in review of the literature. So if you have somebody that appears to be in remission in their arthritis, but their oxidative stress markers are really high, like lipid peroxides, I'm going to show you, 8-OHDG, oxidized LDL, F2 isoprostane, there's a couple of other markers as well. If you know that this person still has high levels of oxidative stress, even though they appear to be in remission, they have no clinical symptoms, you know your work isn't done and you're not out of the woods. And that's one of my clinical pros I want you to understand. And so how we're going to do that is we're going to be able to we need to do some testing. So this is my go-to test. I actually do a NutrEval on just about everybody that comes in, or a urine one. I do nutrient testing. It tells me so much. I get so much information about the current state of the person's body. And biochemistry and their systems, the functioning of their systems, by just looking at a NutrEval. And I think I did another Genova talk either last year or the year before, I don't know, you guys can sort of look at that, but I think I did another one where I really talked about the NutrEval and how I use it a little more in detail. But here I'm going to show you a little bit about that. So these are your lipid peroxides. This is your 8-OHDG. Both of these are validated markers for measuring oxidative stress in people with inflammatory arthritis. Now, this is what the page looks like on the back page of the NutrEval. You can see that you get metals too, which I think is always helpful. And then in addition to lipid peroxides and 8-OHDG, you also get glutathione, which is more of a sign. Glutathione I look at as more of a sign of the reserves of sort of the oxidative stress system. When it's really low, it's suggesting that that the reserves are low for the capacity, the antioxidant capacity in the body, and that's an important thing to know. Even though I did show you the one study on rheumatoid arthritis that did measure glutathione and found it was correlated with disease activity. Finally, there is this, Genova offers an oxidative stress. You can do is just a separate oxidative stress analysis. And this one's sort of cool because it does talk about reserve and total antioxidant capacity and really gives you a better sense about where someone is in their whole oxidative stress system. It also gives you a little bit of enzyme activity, which is great. And then, as you know, I told you lipid peroxides looks at damage. And so I tend to, because I do so many NutrEvals, I don't end up ordering this one that much. I tend to rely on the other, but I think it's a really good test, and I have used it several times. Okay, so moving on to the case study. How am I doing on time? Okay, 10 minutes. Perfect. Okay, this should be 10 minutes, no problem. So I picked a woman with rheumatoid arthritis now to talk to you about, and sort of how I sort of interpreted her oxidative stress markers and her testing. And so here she is. Now she's a little unusual, and your common RA person who might come, because you'll see from her timeline that she had already started treating herself, because she already started my first book, Immune System Recovery Plan, 3 months before she came to see me. And she went on the step 1 is using food as medicine, and she had gone on the whole sort of anti-inflammatory elimination diet and done gut treatment. And so she was already improved. She actually was semi in remission. She wasn't having any joint pain, but she was ready to get off of her meds. She really wanted to get off of the methotrexate completely, and she was still doing the Rituxan. And one of the issues that she had was that she had really low white count, and she had neutropenia, really low neutrophils, and her whole team felt that that was related to the methotrexate. So an imperative to get her off. The other thing that's interesting about her is that she was an ER nurse and married to a surgeon. And she was in the middle of doing like her holistic nursing studies. So she really took this whole thing to heart. And it was a two-edged sword, because she was really working on treating herself. And sometimes she would sort of do her own thing, right? Which would work really well in some ways, but in some ways it didn't always. And I'll show you about what I mean by that. But anyway, timeline, I always do, like the timeline for all of us here at Blum Center. I don't know if all of you are doing timelines, really important. I don't want to spend it with time constraints. I don't want to spend too much time on this. But what I was interested in is IVF. I always think about toxin load, right, for IVF. Like those hormones are really interesting. But she, in 1999 was the first time she ever had it started with her hand swelling, and she ignored it. She was a working mom. She had her children after 40, so she was breastfeeding, running marathons, ignoring her hand swelling for a while. And for her, there is this pattern of stress and flare. And that's another sort of take-home pearl. I notice in my inflammatory arthritis patients, after a big stressor, that's like, if somebody comes in, they've had a flare, there's always some huge thing that happened that's a stressor, you know, beforehand. And the stress can either derail the food plan or directly affect the gut. And so that's been my experience. But she had this big stress with flare, and that's how she ended up on medication. And she then put herself on a macrobiotic diet and put herself into remission with food only, okay, which was really great. In 2002, her symptoms came back, and she was put on more medication, which put her in remission. She seemed to be in remission with a normal rheumatoid factor, and everything was sort of okay. She was only working a day a week. She's tried to find more balance, but all of a sudden, 2005, she surfaces a lot of gut issues. She develops all these gut symptoms, and endoscopy's normal. She does the whole conventional workup. And she just lived with all her gut issues for a whole bunch of years. You can see it all the way up until 2009. 2009, she ends up with a positive PPD and ends up on a lot of antibiotics for 7 months, and a lot of bronchitis. So tons of antibiotics, which is another thing I always think about. I always do antibiotic history to try to get a sense of gut, right, and gut health. In 2014, so she's percolating along, just ignoring all of her gut issues, right? She's trying to manage herself with diet. And then she had a huge problem in 2014. Her father and brother both died. She became crippled, couldn't pick up a cup. She ended up for the first time on prednisone. So see this pattern of her sort of ignoring her issues, didn't really know what to do about her gut, let it fester, and then she had this big flare. And she ended up on a lot of prednisone. And then she really worked on, and 6 months ago, and so she started really working on get the prednisone finally. So in 2015, finally the prednisone got her into remission. She got herself off, and then 3 months before she saw me, she finally started doing the immune system recovery plan and started doing the whole gut cleanse program. That's the gut repair program, which I'm going to show you, and she did much better. And so let's talk about her program. So she came in at the first visit, and I wanted to show you her testing. Okay, so first visit, I sent her home to do testing, right? And so I sent her home with this plan when I first met her. I said, okay, continue with the gut treatment, add Ultra-Inflamex. I really like that's a Metagenics product. It's just something I love to use. I really worked on the glutamine aloe licorice, kind of zinc carnosine. I really like heartburn TX from Vital Nutrients. High dose oils. I really like Inflammatone from Designs for Health. See, I'm not belonging to one supplement company, but this is really good for pain and inflammation, and got her on sort of a good balanced program. And I sent her home to work on her periodontal disease, which she had a history of. And I sent her home with testing. So this is sort of, you can go back and look at this. This is just a summary page of my treatment plan I sent her home with. This is the list and how I did it. All these other things she was already on. So she was already doing Osteovantive from Metagenics, which is Nature type 2 collagen and a pain hops thing that they use. So she was already doing some of these things. I added these things, okay? And so sent her home, and then she comes back 6 weeks later and says, I feel great. And don't forget, she was already in remission when I first met her. Lost 15 pounds since she started the program. Her gut symptoms were gone. Really happy, still in remission, no pain. But when we looked at her markers, I'll show you the NutrEval in a second, but her CCP levels were greater than 250. And this is what I was talking about the rheumatoid arthritis. That's a very specific marker for antibodies, cyclic citrullinated peptide antibodies. There's a lot of research looking at connecting that with oral dysbiosis and periodontal disease. That's why I gave her the water pick, because I knew that from the first visit by history, but I confirmed that she has really high CCP. So even though this woman is in remission, technically, she still has huge numbers, and the studies show unless you get her CCP down to normal levels, she will be in risk for relapse. She will never completely be in 100% remission without treating that CCP. Okay, so a little bit of a heads up for that. Here's her NutrEval. And this is sort of the home page. And you can see, so I knew right here that her antioxidants, that she had some, oxidative stress still going on. And in wanting to know exactly what that was, this is where I sort of get my sense of that. So she had high O8-OHDG, so she still has oxidative stress. Interestingly, her lipid peroxides was great. So I was like, okay, that's pretty cool. Her glutathione is just sort of borderline a little low. She definitely had metal, so it is good to know that, right? So I had to counsel her on eating less fish, figure out, sometimes a one-off, you don't know if lead is a chronic issue or it's sort of a one-off problem, like they just had some acute exposure that they didn't know about. So we always sort of follow that or retest it. And then looking at the toxin detox markers. And this might not be the conventional way to look at detox markers, but I always sort of correlate that with oxidative stress, because the your detoxification system relies on having sufficient antioxidant capacity in order to detox. So I do think of that in the global discussion for me of oxidative stress. And so she had the neutropenia still, and that's still something we follow. And so I sent her home and I said, let's keep trying the biocidin is an herbal antibiotic blend, and it's a liquid, so I start people on the water pick with the biocidin and see if I can't make some progress with that. And I did all of these things, and you can see that here in the list. So this is my EMR system. I have this supplement printout that I give people, and this is her full program. I mean, this is what she went home with, okay? So a lot of this, like I said, she came in with me. She was already doing, and then these are the things I added. So Phytoganics is a powdered, I really like for oxidative stress using these sort of powdered food-based antioxidant, high ORAC value powders. This is an organic one from Metagenics, but all the good companies have different ones. Some are more green, some are more reds. So I always have my oxidative stress people add this powder to their program. I added vitamin C, CoQ10, I added NAC because her glutathione looked a little low to me, and her detox markers, a probiotic, and the B Supreme. And I sent her home with that program. Now, she tended to come back every 6 months. So she comes back 6 months later, and she said, okay, you know, overall I feel really better. I actually ate a lot of tomatoes. I loosened up my diet just a little bit. I'm still in remission. Isn't that great? And I'm actually tapering down to 6-methotrexate, so I'm really happy. And so at that time, I couldn't do her stool test the first time because she was in the middle of a gut cleanse. And so this time I got her stool test results, and she definitely had a little yeast, and she had some Klebsiella. Now, Klebsiella is an autoimmune rheumatoid arthritis bug. We don't want her to have that much Klebsiella. And so I said, okay, we're not done treating your gut. And I gave her the option of doing prescription antifungals, and she wanted to do herbs instead. So I sent her home on GI Microbex, which is from Designs for Health, and oregano. You can use whatever oregano you want. And I did a combination of that. And also at the same time in her test results, all of her inflammatory markers are normal, right? And these are all the ones I did in her conventional blood work. And I didn't do her oxidative stress markers again this time because I had just done it, and this was just 6 weeks later. So this is what I added, some gut treatment, and we added that to her treatment plan. She comes back 6 months later, and she says, oh my God, I'm in this terrible flare. I'm a mess. And she was dealing with skin cancer in her face. But all her joints hurt within a month after this sort of trauma. So she wanted to do a Rituxan treatment, fine, but she really went off the wagon. I mean, bagels, no supplements, stopped everything, couldn't cook. I mean, as bad as you could think. And a month ago, a month before she saw me, she did the test that I'm going to show you, and then she started eating. She said, I'm getting back on the gluten-free diet. And so her test results are here. Look at her oxidative stress markers. I don't know if you remember her first NutrEval, but they were sort of in here. There was only one. Vitamin C was up here. Everything's now. Her oxidative stress is much higher. And you can see now her lipid peroxides are up. Her 8-OHDG is up. Glutathione is a little lower. It was 926 last time, and now it's 889. And so she had stopped eating fish. Her lead was down, so that's all good. But her oxidative stress is much worse, and it really correlates. What I want you to take home from that is that it really does correlate with her flare, right? Oxidative stress is up. And if you look at her detox markers, those are also up. And so her system, her whole body is sort of struggling under the weight of this flare that she was experiencing. Now, her stool test at this time with the flare showed that, let's see if we have the last page. Oh, yeah, so a lot of her cultures were much better, but she has sort of this overgrowth pattern now, and her beta-glucuronidase is high, which makes me think of anaerobic overgrowth. And in fact, she did turn a positive now to SIBO. Now, you know, I didn't do the SIBO test before. Maybe she always had it. But, you know, stress and terrible trauma, I mean, that's one of the big triggers for SIBO as well. And SIBO is a form of dysbiosis and increases leaky gut as well. And so I said, okay, we know now we really need to treat you. Your oxidative stress markers are up. We need to work harder. So when you see someone with these high oxidative stress markers, it tells you you're not done. And there's a lot of work to do. Stress can worsen SIBO, periodontal issues. She had given up, right? So that was a big issue. And so the other thing about her was that I had some other things that she didn't come back regularly. She was coming back every 6 months, which was probably a little too long. She had a very high tolerance for pain and would sort of go along with things and not treat them right away and let them slide. And she wasn't keeping regular appointments. So I just wanted to say that was my little struggle with her. But at this point, I sent her home, and let's see if I have that for you. I sent her home with I had to really talk to her about stress and her management of herself and how she's going to get help. And I did a lot of mind-body kind of brainstorming with her about her PTSD, which she was definitely showing signs of. I sent her home with a treatment. I sent her to a biologic dentist. Yes, I kept treating her, but I realized it wasn't enough. And I sent her home, and I gave her more gut treatment. And don't forget, this is like every 6 months now because I hadn't seen her for 6 months. Got her really back on a food plan, which was really good. I added a lot of antioxidants. And she wasn't even taking the stuff I gave her last time, right? And so I added antioxidants, kept treating her gut. She came back, and this is the last 2 slides, she came back 6 months after that. So, I mean, I wished I had seen her sooner, but I didn't, and I was supposed to see her sooner, so I hadn't given her another oxidative stress test to do, so I don't have another one to show you, but she really wasn't taking everything again, so I had to really give her a whole pep talk about that. Her rheumatoid factor, I had told her to do the repeat NutrEval, but she didn't do it. The rheumatoid factor had dropped, which is good, but her CCP is still high. So she's not out of the woods. But my goal was, but she did drop her methotrexate. So she's sort of managing herself. So it's a little frustrating, but the point was, and you can see where her head's in. She's, maybe I'll take the Rituxan just so I can go skiing, right? So she's sort of 2 feet, 2 steps forward and a step back. But the point that I wanted to make by showing you her program was that her symptoms, the oxidative stress markers are completely aligned with what her clinical picture looks like. And that it's really important to follow that. And so I'm waiting for her to come back with a pending, after doing my next round of treatment, we'll see who her oxidative stress markers are. But I'm really using that to follow her, and it really does seem to follow along. And so in her last visit, the most recent, I gave her a lot of antioxidants. And so we took a pause on the gut cleanse, and I really upped, and you can see all the antioxidants here. Gut repair, worked on gut repair, and I'm waiting to see her again so I can see if we're making some progress. And so here are my take-home pearls, and how am I on time? And I'm sorry, okay, still 10 minutes left. Oxidative stress markers can be followed and correlate with disease activity. True remission is not possible while these levels are high. And so that's really important to keep in mind. Clinical symptoms might be gone, but a flare is lurking around the corner with the next stressful or traumatic event. Look for the sources of oxidative stress. She had chronic gut and oral dysbiosis. If the CCP is high, I know I haven't gotten ahead of her oral periodontal issues. Work with your patients on awareness of stress and trauma, and the lifestyle is really, really key, because at the end of the day, unless the lifestyle is good, the gut is never going to get fully healed. Okay, and so, and this is my book that I was sort of referred to a few times. It came out in October, and it's sort of one of the reasons that I've become, well, I was passionate about arthritis, and that's why I wrote the book, but it's really helped me sort of learn so much about this topic. And so, yeah, so let's answer some questions.
Sounds great. Thank you, Dr. Blum. Just a terrific presentation, and we received a lot of good feedback. Just want to remind everyone that the PowerPoint will be available on our website in PDF format next week. And let's start with some questions. One, just kind of piggyback on that case, did you do any cortisol testing for that patient? There was one question that came in.
Oh, yeah, I'm sure. You know what? That's a very good question, and I'm sure I did, but I didn't put it in there. I mean, although I should say that she really didn't always do all the tests I wanted her to do. But I think that would be a really important thing to know. And I offhand, I can't remember. So I'm sorry.
Yeah, and I think it knows that correlation between high cortisol and
I actually think maybe she didn't, maybe we never really did it. But here's the thing. She came in on prednisone. And so it took a while. I think she came in on very low doses of prednisone when I very first saw her. So we probably couldn't do it at first, but but that would be a very good thing to see if I had done it. I don't think she did it. I was having a lot of trouble with compliance with her, and I don't like the word compliance. She was just sort of in and out and sort of did things on her own. But knowing what her adrenals were doing would help, and supporting her adrenals if she needed it was certainly good. She had tons of energy. The woman came in and she would say, she was like, I'm good, and I don't know if this is just her own perception of being good, but I'm good, I'm in remission, life is good, I'm going skiing, so I don't know. But anyway, sorry, I don't have that information for you, but it would be a good thing to know.
Yeah. One other question, any special considerations for a patient or patients with juvenile RA who now have been on long-term anti-inflammatory treatment, immune suppressive treatment?
Yes, I think kids with JRA, God, it's so hard and so sad. I have several of them in my practice. I think it's really important to do a really, really, really good timeline and go all the way back to right before they were diagnosed to try to understand if there's any sort of infectious triggers that you could identify. I think that those people need to be definitely tested for Lyme. I think those people, you want to test for mycoplasma and other, just try to understand if there's anything that was happening that's interesting infectious-wise, if this could be a whole reactive kind of arthritis. But other than that, no, you're going to do the same thing. And so, and often you get a history of severe infections and antibiotics, like all this sort of gut stuff that the kid had since they were born. And so there's just a lot of gut work to be had there. And so I think that especially the young, even if they've been on medication for a really long time, the healing the gut work is going to take a long time. And I think that is sort of one of the special considerations. And that's true of any rheumatoid arthritis person or any person, psoriatic arthritis, anyone who comes in that's been on these kind of, whether it's prednisone or any of the DMARDs, the disease-modifying anti-rheumatic disease drugs. If they've been on them for a long time, it's a bit of a devil to taper them off slowly. And that's actually the story you see in my case study. And she did over the course, even though she was flaring intermittently, she came in at 15 and she was on 6 by the time we were done. At the last time I saw her, and she's really going to get off. But it's a long haul. The gut is an ecosystem. Go back to that ecosystem slide and look at all that in the context of a young adult, a teenager or a child. The lifestyle piece is so important to establish the future. That they've got the rest of their lives ahead of them, like a lot of these people, and the work in establishing a healthy lifestyle that will support a healthy gut microbiome is going to take a long time. And I think as practitioners, my advice is to set your own expectations about that, because sometimes we feel we failed, or if they come back and they're in a flare, like that's some reflection on us. Or I think it's really important to set that expectation, like, okay, everyone, this is going to take a while. You didn't get here overnight. Healing the gut takes years. It doesn't take 2 months. And so this is a long-term play. And we're going to work on the gut ecosystem, and you will feel better. You'll consistently feel better and better and better, but it's not going to happen overnight. The people that come in that haven't been put on meds yet, new diagnoses, the early seronegative inflammatory arthritis people, rheumatoid arthritis, somebody told me I have RA, my tests were all negative. Those are great. Within 3 to 6 months, you can have them, like, all their arthritis gone, using this kind of a program to heal the gut and the food and the stress. But the deeply entrenched people who have been on meds a long, long time, everyone just has to understand this is going to take time, but you'll get there, and you will totally help these people. I mean, you're the only hope they have. Otherwise, this is going to be the rest of their lives, and they're going to get more and more crippled as they get older.
Perfect. I think that's a great summary. And in the interest of time, we're going to end our question and answer period there. For additional educational materials, we'd like to encourage you to visit our website, www.gdx.net. And on this site, you'll find sample reports, kit instructions, and other information for all of our patients.
Okay, and I will say, I don't know if I'm still live. Can you still hear me?
Yes.
Okay, yeah. So if anyone has questions that you want to reach out to me, you can send it in either through Michael, through DDX, and they'll forward me questions. And, as long as it's not too onerous, I'm happy to help out. But that's one of the reasons that I put those, I gave you detailed slides. I mean, I gave you the list of how I even prescribe the supplement pages. Those are the treatment plans I give my patients. So I tried to really provide a lot of material there's a lot of really good little tidbits in there. So go back and look at the slides and the supplement lists, and hopefully that will be helpful.
Yeah, and that will be up on our website. If you need any assistance in setting that up, you can always call our customer service here. The number's going to be on the screen right here. And finally, we'd like to encourage everyone to look for our upcoming webinars on www.gdx.net. Next month, we will have Dr. Terry Walls presenting on dietary approaches to treating multiple sclerosis. And just thanks again, Dr. Blum, for a superb presentation.
Thank you. That was great.